Good morning here from the West Coast, and good afternoon if you're on the East Coast. This is Dr. David Nace, Chief Medical Officer here at Innovaccer, and welcome to this webinar, Building the Future of Health, a Story of Innovation. So we've got two great panelists to talk a little bit about the digital innovation that's occurred with the movement we've seen in digital transformation in the industry, but also the acceleration we've seen with the pandemic. So let's get into it. So first, I'd like to introduce our two panelists. Anna Taylor, who is the Director of Operations at MultiCare Connected Care in Washington, the state of Washington. Anna, welcome.
Hi, thanks for having me.
It's great to have you. And Tamra Ruymann, a Chief of Digital Health at Physicians of Southwest Washington, also in Washington, of course. Tamra, welcome.
Good morning, Dr. Nace. It's nice to be back.
It's great to have you here. So with no further ado, let's kind of get into it. So there's all this talk about digital transformation and many of these technology companies getting into healthcare or trying to get into healthcare, interoperability, and then with the pandemic, there's been an acceleration. Obviously, many of us are using remote communication techniques like Zoom and other things. So what is the issue around digital healthcare, and why is it taking so long to get there? And are we at a tipping point? Tamra, let's start with you.
Yeah, I think that.
Go ahead. Sorry.
Oh, yeah, I think that we are at a tipping point. I believe that there's a lot of government initiatives, actually internal initiatives that facilities and big entities have. We see a lot of movement with outside entities forming healthcare companies in order to assist and drive the new initiatives forward. And it's if you can't aggregate your data, then you're sort of at a place that is not going to allow you to move forward in the future. That's how I see it.
And it sounds like you're chopping at the bit to make a comment.
Thanks, Dr. Nace. Yeah, I most certainly believe we are at a tipping point, and especially a digital one, as we have all of these years of bits and bytes underneath us now. We have all this data. Now it's getting it to talk to each other and unlocking it so that we can really deliver on what we all got into healthcare for, which is improving the lives of our patients.
Yeah, I like what you said about unlocking it. We spent a lot of money in the Health High-Tech Act, getting EMRs in place, and now we, have the issue of we're recording lots of data, but is it being used? And it seems like things are kind of disconnected. The different opportunities like applications and systems, do they talk to each other effectively?
Well, in my opinion, they don't. This image always reminds me of a solar system, right? These are different planets. They're in their own rotations, and there's no interstellar travel. So we're really trying right now to unlock and make those pathways and travel pathways paths of least resistance so that we really can deliver on that whole patient view of their health and get to that well-being definition that I think probably got popular in maybe 2010 or somewhere around there, where we're really talking about our well-being and how we moving forward in life. All this data can help us understand that and further define it, but it's all on its own planet. So it's our jobs to help that interstellar travel come to life.
Well, that's going to be kind of tricky, this idea of well-being. I have to schedule an appointment with my doctor 3 to 5 weeks out, go have a visit, and then they ask me, why are you here? So that's not very connected, and it's not very well-being oriented.
No, absolutely not.
Tamra, do you have a comment on that?
Yeah, I think that we're seeing a lot more work towards getting these connections made. I think that there's a lot of standards out there that have been put into place to try to move that forward. There's a lot, we've heard about a lot of the Da Vinci work and the Karen work that's going on so that we can start connecting. I think we still are a little bit out there in the timeline for making that happen, but there's a lot of folks like Anna and myself who are furiously working on this so that we can provide that critical patient-centered care that needs to occur.
That's right. And I think you pointed out, just to get the audience level set, you know, Karen is an HL7 sponsor group to get connectivity with the consumer and thinking about what that means. And Da Vinci is a similar ONC, Office of National Coordinator sponsored HL7 related group, looking at the payer-provider connectivity. So lots of people working on this for sure. What's a vision of what this might look like and how we might get there?
Well, this is certainly one. Oh, go ahead.
Go ahead, Anna.
This is certainly one of this is from Deloitte and their study on interoperability, where we're putting the patient, the consumer, at the middle, as we have been shifting that, even in care providers, shifting that patient to the middle. And around the outsides are the well-being, the care delivery, the data and the platforms that support this whole ecosystem, this universe, right? If we're talking about planets and disconnections and interstellar travel, this is the universe, and it all centers around the patient. And each one of these pieces have to have capabilities that enable them to be connected. And that's the aggregation of our data, and then the outside aggregation of our care.
Yeah, so, you know, I often think about the physician's office practice being very physician oriented, right? You know, like I pointed out, I have to make an appointment, I go there, they have what data they have, or if I have an insurance, it's insurance company oriented. It's not patient centered so much. How do we get the data to be more patient centered?
Anyone? Tamra? Anna? I can answer.
So I think that bringing it all together is going to allow us to have better insights into what's happening with patients. We also have to consider that our patients these days are of a different generation and have higher or different expectations than, you know, the patients of 30 years ago, or even myself. As a patient, I have a different expectation than my child does when they go and see a physician or a doctor. So I think we need to be able to understand that, you know, working on this, and I'm looking at the visual, working on this and making sure that at the point of care, the physician has all of the information in one place so that they're able to actually have a more robust conversation with the patient about all of the things that are happening with them, and really deliver on that care from a proactive perspective. It's more well care, less acute care, patient-centric information, so that we're moving forward and keeping our patients healthier at the same time, teaching them how to manage their own chronic conditions. But to do that, you have to have all of that information at your fingertips when you're seeing the patient.
Mm-hmm.
Yeah, I often think about this as a physician who is of an older generation, as this light blue of treating and assessing as being the core things in the patient receiving that care. But this idea of monitoring and then providing advice and support, that's for real time.
Yes. And I'll tell you one quick story. Going to a cardiology group and knowing that they have a connected electronic medical record to something my husband had, I'm like, no, I'm not filling out the address form again. Sorry. So as patients, holding the physicians responsible for pulling down your record and doing the work because you know it's connected. In this day and age, it has the capability. And as a patient myself, I hold them accountable to getting it. They squeak and squawk. They're like, oh, that lady just asked, but too bad. I need you to coach me.
I love that. And as a physician who's practiced a lot of my career, and also as a patient who's received care, I can't imagine how many forms I filled out. And I think about all the data entry problems and all those silos that it's going into. So it sounds like a new approach is needed. You know, What is this new approach?
That's the interoperability. That's the aggregation of all this data. And that's the universe talking to each other in harmony of healthcare data, so that all the people who are doing the work have the information and knowledge to give you the best coaching advice, the best well-being advice for you as an individual. This is right back to unlocking all of those planets so that they can talk to each other, so that your cardiologist has what they need to say, here, oh, I see you work, here's your Apple Watch data. I see you work out, you're extensive athlete. Oh, I'm not worried about you having a 40 beats per minute heart rate because you're probably in really good shape, period. There's nothing else wrong with you based on all the diagnostics. So it's really unlocking all those pieces. When you go to the doctor's office, you can't remember there's so many things, so many root causes to a diagnosis, and having those connected can really personalize the treatment. So it's really about approaching healthcare with a data integration mindset, and then holding our care providers accountable to using that data and really tuning into what you need as an individual. So for me, it's really about the tools, the bits and bytes that make that happen, and unlocking the data.
Yeah, I'm hearing a couple different things. A change in the physician-clinician relationship, different expectations from a new generation, which is they want a better digital experience, having better accessibility than making an appointment 5 weeks out, and offering this sort of continuous ongoing tracking of data, and also giving support and guidance when needed. And I mean, that's fascinating. And then there's another issue as well, is we all talk about the social determinants of care, right? And so how do we think about transportation needs, food needs, housing needs, et cetera, safety, violence? So interesting things to get into. Let's check in with our audience and see what they see as how their organization might provide more seamless care that we've been talking about. So those of you in the audience, please use your chat box feature and select one of the following. Enhancing physician-patient relationships is the most important to getting more seamless care. Offering a better digital experience, improving accessibility to services, offering ongoing outreach and engagement, or connecting with the community services, community-based services in your community to help patients with their social determinants of health. So let me, while we're taking that call, let me ask and start with you, Tamra, where do you see the opportunity for providing this more seamless care? How close are we to getting there?
I think that I look at it from a couple of perspectives. So you have your small independent clinicians that don't really have a lot of ability to spend much in the technology arena, and then you have your big facilities who do, but then they focus mostly on internal systems and not always on the external connections that they may need to supplement their internal systems. So for the small clinicians, having the ability to provide them a data aggregation tool where they have the information in support of those visits with their patients that allows them to provide better care, not just better care because it's better care, but because they have all of the information that's needed from all of the patient care that may be outside of their specific clinic. I think from a facility standpoint, they become very dependent upon their EHR to provide them all that information, and lose sight that there is external information that would enhance that data that they have at their fingertips and allow them, again, the same opportunity to provide better care because they have more robust information. So really, I think an opportunity is to be able to, at the point of care with the provider, serve up that information so that they have it provides that better digital experience, but also enhances that patient-clinical relationship.
No, that makes a lot of sense. I like this whole point of care concept of being able to have the information at your fingertips. I remember in my training, I had to pick up a paper document on the door and quickly read about the patient before I walked into the door to see the patient in the office. Let's check in and see, looks like the poll is done, and see what our audience chose. Interesting. Anna, what do you think of these results?
Yeah, it's actually really interesting. I think the top two, improve accessibility to services and staff, offer a better experience for patients. Those two are probably highly related. So as they are in the poll here, we can offer those improvements through digital infrastructure changes that enable us to access lives and patients more easily and simply. I think those are the two strategies that certainly together create the new universe that we're looking for. So
Yeah.
it sounds like the audience is on the right track for their strategies.
Yeah, I think the other thing I see here is that community-based services, we're still on the cutting edge of trying to figure out how to engage with it. So that makes a lot of sense.
Yeah, and makes a lot of sense to me that even that data is emerging. What kind of data do we need to do that work, to make decisions, to drive the strategies? It makes a lot of sense that that would be a lower one at this point. Mm-hmm.
Awesome. Well, let's get into some case studies and the experience that each of you have had at your organization. So let's start off with the first one, which Tamra, I'm going to ask you to kick off, is your approach to achieving success at Physicians of Southwest Washington, particularly around value-based contracting. So first, you could tell us a little bit about Physicians of Southwest Washington, PSW.
Yeah, so we've recently actually had a name change. We're just going with PSW, so that you know, because we're no longer just in Southwest Washington, we're throughout about 18 states in the US. So we are a population health company. We have taken on risk under payer contracts since 1995. I started here in 2008, and we have over 100,000 beneficiary lives or patients that we help manage, 55,000 of which are Medicare. We're in an ACO. We've recently, over the past couple of years, partnered with MultiCare Connected Care, and we work in tandem to provide population health support for both our populations that we manage and MCC's populations that they're responsible for managing. Again, we're here in the Pacific Northwest, but we are throughout many states in the U.S. Providing services in the population health.
That's awesome. It sounds like you've had some incredible growth and obviously a tribute to the success we'll get into. Anna, maybe you could speak a little bit about the relationship to the two organizations for the purposes of this webinar.
Yeah, absolutely. MultiCare Connected Care is an ACO that is solely owned by MultiCare Health System, who has a lot of brick and mortar locations, as well as virtual services, the whole gamut of the care continuum MultiCare Health System has. So partnering with a population health engine all the way to the entire care continuum has really enabled us to take on the emerging markets such as value-based care and financial models as they come out, and we understand that treating patients needs to change. This partnership is really transforming how we do our work as well as a care delivery system.
I got that. So PSW is the population health engine, and MultiCare is the delivery system providing enhanced value to their patients. Got it. So let's get into okay, so what, as an ACO and as a population health engine, what are the key levers to getting success? So we have a couple here. Let's start with physician engagement.
Yeah, so we have spent a lot of time perfecting some of the things that we do, and it's always different from group to group that we're working with on how we want to do this. But some of what we've put into this deck is really related to things that traverse each system. So with physician engagement, you need to actually get them engaged in these value-based contracts. A lot of times they're just doing the day-to-day work and not realizing what's happening and how they need to manage these levers. So we do a lot of analytics that we provide them. We also work on giving them, and that's related to performance, but we also work on giving them information related to data-driven activities that they can do that will improve their performance. So really trying to make sure that they have actionable data at their fingertips for their value-based care contracts.
Really,
oh, go ahead.
No, I was going to say it really points to the importance of data.
Yes, it does. We also have worked with them because we feel like when there isn't a lot of triaging, I think, that comes related to these value-based contracts. That there's messaging when you call in for an appointment as a patient. You've probably experienced this, where you've called in to get an appointment and they've booked out and they don't have room for you, so they direct you to the emergency room because they want to make sure that you're getting care. It's appropriate. We've done a lot of work on encouraging after hours times, really promoting the urgent cares over ERs and having the front desk office staff trained so that they can assist in making sure that they do a little bit of triage for those sickest of the sick so that we can get those patients in when they need to be seen instead of diverting them to an ER. So
it really sounds like a focus on not only engaging the physicians, but providing better access to care for the patients, right?
Yeah, that is what we're encouraging and training. I'm hoping that the providers really understand the valuable pieces that they can provide based upon a little bit of change at that front desk. Yeah.
So better access, what does that mean for the actual patient, the beneficiary, right? So, how do they think about it? We often talk about patient engagement. How does a patient end up feeling more engaged? How do we get them better engaged in their wellness and in their care?
I think that what we've seen is, patients they just want to be seen. They feel like they have a reason to go in and be seen. And so a little bit of training with the patients as well. We do that on both sides, not just with the physicians, but access training with the patients so that they're using the right level of care. You don't necessarily need to go to an ER for every thing that you need to be seen for if you can't get in to see your doctor that day. And so really focusing on urgent care and the value that it can bring to the patient as well, knowing that some of the dollars out of their pocket are going to be less if they use urgent care versus the ER, but also helping the physicians understand some of those different levels of care too. A doctor is just trying to make sure that the patient gets the care that they need, but not necessarily knowing that from one entity to another, the cost can have an extreme difference on the patient, and therefore they may not get the care because they can't afford to get the care. So there's a lot, I could go on for hours about this subject. There's a lot of information behind it. And I hope I didn't just travel down a path that you weren't intending to go to.
It's great. We were talking about this issue of data, this concept here of the impact for the practice, the EHR connectivity and communication and reporting, which is often a key part of these contracts. How do you tackle that?
Again, we were generating a lot of reports before we actually connected with Innovaccer, and we were doing regular engagement with our providers and handing over that information and going through it on at least a quarterly basis, if not more often. With the solutions that Innovaccer provides us, again, it's that point of care solution. We're able to give a lot of the information that is needed at the bedside for the patient through that point of care solution. And so we have that opportunity with all of our clinicians that they would be able to have that information through the data aggregation that we're doing in the Innovaccer platform.
So I love this slide, which really kind of pulls together the approach in general. It seems like it starts with data. Is that right?
Absolutely, it does. It starts with the data. It starts with the interoperability, That's where we're going to get the foundation of the intelligence that drives the decision making as you look across this scale of care. So at the foundation, you have all the bits and bytes that drive decision making in 2, 3, 4, and 5, that drive care in 2, 3, and 4, and 5. And when we get to the how, you also have all the interoperability, the Da Vinci standards, the care and effort, the gravity projects. All those things are creating standards so that those bits and bytes can deliver more efficiently and easily on their intelligence for the rest of the spectrum. So that's really the foundation. And then Tamara, I think you're going to talk about how the care is utilizing that foundation.
So with that data and just looking at that data column, we're able to manage our star rating and manage our risk adjustment information and HCC recapture. We also, with PSW, we spend a lot of time on care management activities, really engaging with our patients to make sure that they have what they need, and it reduces a lot of readmissions, it reduces ED utilization. We are able to risk stratify based on all of that data so that we are providing the services that are going to be the best return on investment for not only our value-based contracts, but for the patients as well, so that they're getting what they need. We also are able to spend time on education with our patients so that they are, with all of the information, we understand what their chronic conditions are. So we're able to spend time teaching them how to do self-management of those conditions. You notice that we have transitional care support that really just falls into the bucket with our care management solutions. So anytime a person is discharged from a facility, we do a lot of outreach and try to get that patient back in to see their primary care provider. We do primary care provider connections. So as you know, with this new generation, a lot of individuals don't really have that primary care relationship like possibly the older generations do, and we want to establish that relationship with those patients so that they have somebody who understands all of their conditions and what's happening with that patient from a health perspective. We also really focus in on utilization management, and we'll talk about a couple of those successes that we've seen through the activities that we're doing. And again, provider engagement, it's a big deal. Providers need that information in order to be able to provide the best care at, the right care at the right place at the right time, I guess would be the best way to state it.
I love this. We often use the phrase here as care as one, meaning how do you have everybody on the team engaged, the patient, their family members, the doctor, the care manager. And it looks like this sort of approach kind of pulls it all together so they can work together. Is that right? It
does, yes. And, again, it allows you to see all of that information in one place. And we're, by no means are we saying that we're perfect. There is always new data that we identify that we don't have, but we are trying to integrate all of that data that we know of so that we can give a more robust picture to our clinicians and really work with those patients.
Oh, that's fabulous. Let's talk about the outcome of this approach. What kind of results have you achieved?
So we have focused really heavily on the post-acute lever. So we focus more in on skilled nursing facilities at this point in time. We realized that there was sort of a culture that if you were an elderly individual and you had been in the hospital for any surgery of any kind, that you probably needed to go directly from that hospital to a skilled nursing facility. And we've really worked with our nursing facilities locally and in the other states that we're in, and sort of started doing some reporting based on the analytics on length of stay and the cost of care, and understanding when it's appropriate and And we've made some real heavy successes in that arena. We do what we call joint operating committee meetings with our skilled nursing facilities, where we all come to the table. We share with them a quarterly scorecard on, again, those pieces, like how many readmissions are we having in 30 days after discharge from the facility, and what kind of ED utilization happens while they're in the post-acute care center. And really focusing in on that information with them, and everybody is, when you're in healthcare, everyone wants to be that straight A student. So when you present data to someone and you're seeing it for all of the other facilities in the area, it drives a lot of competition, I would say. And people want to do the best job that they can do for the patients. So I think it's been really successful. With our ACO, we went in 2017. We joined as a next gen ACO, and 2 of the 3 years so far that we've participated, we've had the lowest utilization for post-acute care out of all of the next gen ACOs, not MSSPs, but the next gen ACOs. So I think we've seen a good success there. We've reduced the cost of care, and we've really engaged our post-acute facilities in helping us with that.
Yep, high quality post-acute is often the trick, right? So it sounds like you've used data to really drive that, and also, decreasing the use of emergency departments as well. Is that right?
That is true. So we've seen success there year over year since 17. I would say in 19 we had a higher rate, but that was because we brought in a physician employed group in another state and into our ACO. And so, the benchmark changed a little bit because you're going to see differences in utilization from different groups. And so over this last 2 years, we've worked with them, and we see just based on the numbers, our per 1,000 beneficiaries per year number decreased significantly. Now, also, I want to caveat that we all know that we just went through the COVID-19 year in 2020, so we can't attribute all of that decrease to our success in reducing ED on our own, but we can attribute some of it to it. We decreased that by 14%, and again, we've seen those numbers from 17 to 18 as well. So,
well, that makes a lot of sense. It sounds like you've had some good success, and many of our audience members, as I looked at our invite list, actually can come from running their own ACOs or their own value-based contracts. Let's check in with them and talk about get a sense of the crucial elements that they've had for their success. So those of you in the audience, if we can just go in and take a poll, what are the biggest elements that you experience in your value-based contracts? Is it ensuring interoperability across your network? Is it empowering providers with insights at the point of care, the way we just heard? And then, or is it the use of analytics, either to stratify to find your high-risk patients or for reporting, getting a good dashboard to take a look at, retrospectively, and currently how you're performing. Let's circle back to both of you while the audience is taking this call. What have been the biggest drivers you think that are going on for other people in this ACO and value-based care market? Anna, let's start with you.
Yeah, the most crucial element of success, I think there's many levers when we're talking about value-based care, but I'm going to go back to that foundation, which is the data and analytics that feed your ability to make those actionable decisions on the care and who to provide the care for. Resources are finite. And so we have to understand who needs the care, what kind of care do they need. This is all crucial to success in a value-based contract. So I don't know if I could choose one of these because they all are levers of success, and they all kind of feed on each other in making you successful in a value-based care. The foundation is having the data and analytics to make that happen. So if you had to start somewhere on your journey, maybe you need network-wide interoperability. Maybe you don't, because the claims give you the 4 main data points that you need to be successful in your first year. it all depends on the contract that you're in and what you're managing, but all of these things matter in being successful in a value-based care.
Tamra, it sounds like these things all work together, and it depends where you're starting in your journey.
Yeah, I was going to say that I think we've, really been doing this, like I said, for a number of years. And what we realized, I think, is that each of these probably is a growth point, and we didn't start with network-wide interoperability. We started with retrospective reporting and then moved into network interoperability. So, and one of the things I would just state is when it comes to understanding some of your data points, I think really focusing in on 4 or 5 data points is, I would highly encourage that instead of overwhelming people with 20 or 25 data points, so that you can get good in an arena. And once you've mastered that point, it's time to add a new one to the group. So less sometimes is more in that area.
Well, we don't know.
I'll second that for Tamra. You got to start somewhere, and that retrospective reporting is certainly a place to start.
We don't know where our audience are. I'm sure they're at various points in their own journeys, but let's check in and see what they see as the most important here and pull up these poll results.
Ooh, very interesting answers.
Tell me why you say that.
Because I will say that as a health system, we are thinking network-wide interoperability is going to get us to success in a value-based contract. But the foundation is having the data and information to do that. And so when you think about what that means, it's the intelligence, which is the use of analytics and retrospective reporting. That helps drive where your finite resources are going. So I have to agree with Tamra on that one being probably your first layer in your journey and being successful. That longitudinal patient record of care, I don't know what we call it, the Mecca for patients is complex, complicated. The standards are emerging. We're not there yet, even in national laws. So it's hard to do, and I think it's interesting to see the audience focus in on something that's not a foundation and what has made others successful.
Well, I was going to say that, that's a great perspective, and certainly you've been doing this for a while at MultiCare. Let's move on and talk a little bit about MultiCare as an example, as a case study. But first, I want to say, make sure I got this right. PSW is the population health engine, and MultiCare is the delivery system. So let's get into talking about a nice case study around MultiCare and how the delivery system plays out with the population health engine. So tell us a little bit about MultiCare.
Yeah, so MultiCare is based out of Tacoma, Washington. We serve many communities in Washington State and beyond the Pacific Northwest. We have a physician-led accountable care organization as a part of that entity. And MultiCare Connected Care specifically is a subsidiary of the health system. So we are the ACO and the Pop Health engine that partners with PSW, our small but mighty team, we call them, to enable us to be successful in value-based care. We're at risk for over 270,000 lives, and we have about 3,800 plus participating providers, both independent and owned through MultiCare Health System. We are a strong advocate of sustaining independence in the community, and this network of providers enables us to deliver on that. We participate in all different types of value-based contracts, from federal to state to commercial. Those are all of our portfolio of work. So that's a little bit about who we are and what we're made of, our recipes.
No, that makes sense. Can you say a little bit about the percentages? Like, to what degree are you doing Medicare, which I assume most of the federal, Medicaid, which is probably most of the state and commercial payer contracts as well for value-based care? What's the general fallout? What percentages in those buckets?
Yeah, that's a great question. I'm trying to do the math off of my head. Yeah, right. It's probably heavily commercial, but when we talk about like our main contracts that focus on the biggest portion of revenue that comes into our system, you're probably equal parts commercial, federal, state in all of those. So they're just different in how we move through the system. However, we use the same foundations to do the data aggregations, to move the lives. The things that we specialize in is what waivers in that contract, quality measures in that contract. You know, we hone in on the different things. But now that I think about it, I'm thinking, yeah, they're probably like 25, 25, 25 if you do the math.
Got it. So a real clear balance between all three.
Yeah.
And, you know, you've got over 250,000 lives and 3,800 providers. That's a lot of folks to orchestrate.
Yeah.
So,
and about, let's see, 45 EMRs in that network.
oh my gosh.
Yeah.
Lots of systems and silos to orchestrate as well. And so how do you pull together the group in terms of thinking about a common mission?
Yeah, so our mission is partnering for healing and a healthy future, and MultiCare walks that mission every single day. That is why we have a network of both employed and independent providers. We're partnering with the community to make all of this happen. It takes a village to do that. And so our mission is really around partnering with entities to enable our patients and communities to live that well-being life we're all searching for. So when we go out and talk to our partners, we ensure that they can walk, you know, they walk our values together. It's a high trust relationship and want to live our vision of being the leading catalyst of patient and population centered value in the Pacific Northwest. So ensuring that our partners want to do that with us and be in the journey with us is a curation that we take very seriously. And we believe that everyone that is within that, those 3,800 providers are all along for the journey in doing so.
Well, I can speak for myself, you know, as a technology company, my organization has really enjoyed partnering with both PSW as Population Health Engine and with MultiCare and delivering care to such a significant percentage of the population in the state of Washington. You know, we just finished a year of a pandemic, and partnering with both your organizations, you know, arguably the index case started in Washington. So you were early at that forefront. Mm-hmm. Now we're dealing with this issue of how do we get a vaccine in everybody? We've had tremendous scientific results with creating these innovative vaccines that are highly effective. You know, how have you, let's take a look at how have you used data and information in such a platform and work together as the two organizations in ensuring this vaccine rollout?
Yeah, so I'm going to go back to the poll, tie this back to the poll. So there was, I think, one option about high and rising risk, which is a key lever in being successful in value-based contracting and keeping our communities well. And immediately, I think in March and April is when we said, hey, Innovaccer, can you help us identify who we need to call, who we need to get to as we all are isolating in our homes, who are our high and rising risk in our entire patient population. So we went from only people in value-based contracts to the entire, anyone we had touched in the 3 years, you know, true population health, if you think about the flywheel, you know, of population health. So looking at all of the society and people we serve, figuring out who we're going to work with to pick up that phone, ensure they're getting the care that they need. That was step one. So when the vaccine rollout came along, we asked Innovaccer again, we need help managing this. We need to know who has their first shot, who has their second shot, who needs this shot most and hasn't gone to the clinic to get their shot, who needs us to go to them in our hospital at home model or our health at home to get that shot because they are self-isolating and they need to. All of this intelligence was enabled by the Innovaccer platform to get that data that had already been established for our value-based care. So here's the cool part. you have a platform, you're working value-based care, and now you have an opportunity to scale it to an entire society, Washington State, or all the patients that you touch. So it was an opportunity that Innovaccer partnered with us to make that happen, to enable us to do the outreach to the patients who need to get the vaccine the most, keeping our vulnerable protected. And then also monitoring our progress. How are we doing? Who needs another shot? Who didn't get the follow-up appointment? All of those are actionable data points that we need to make decisions in order to ensure that the right shots are going in the right arms as we need it as a society, which is really powerful in what this platform can do for us. And I think we did that in a matter of 4 weeks or less. Tamra Ruymann cross-checked me on that because we already had the interoperability in place. The plumbing was done. And so it's really just turning on a switch and producing the intelligence that we need to do. So pretty powerful and really impressive in the way that we can, help people get through this. Let's return to our new normal. I'm not going to say it's a normal, but helping us get there.
And I would just add that it was the flexibility of Innovaccer, in that 4-week turnaround time to be able to, hey, we have this use case. Are we going to be able to do this? And when Anna references we, it's a collaborative we. It's all, the representatives on this call, all 3 of us just came together and turned that around in a 4-week time period. So pretty impressive and pretty flexible when you all of a sudden identify your population health tool can actually make a difference in an area that you hadn't initially thought about using it for.
This sounds like real teamwork. You've got technology, population health engine organization that's helping to empower providers, provider organizations like MultiCare, and then being able to have all that data and information to really manage a population. 1.8 million active patients. That's a lot of patients. It sounds like
it's about, I think we're 7 point something in Washington State, so it's a pretty significant part of the population.
So we've got a history of managed care, accountable care organizations, technology coming together to help make these things work, partnerships like you've described. Really, I think the pandemic may have a silver lining of helping get us to a point of really being able to move value-based care and population health into the future. I just think that's a very exciting vision that the 2 of you have painted out. Let's check in with the audience and see what they think the future of value-based care programs will be. The Biden administration has talked about, from a government standpoint, of pushing out more mandatory participation in these value-based care contracts and moving away from fee-for-service, which has been the slow trend. ACOs and bundled care payments may continue to evolve slowly and incrementally the way they have been, or there may be market consolidation, new partnerships and new networks, kind of the private market doing this on their own and driving it forward, maybe the pandemic being an accelerator, or then just being able to have this sort of high-level view of lots of data to benchmark success and learn from each other. Let's take this quick poll. You can go in and select one of the following. And in the meantime, let's talk a little bit about the future. Tamra, where do you think this is all heading from a population health standpoint?
Well, actually, just looking at this slide, I would struggle to answer, because I think I would pick the first 3, all 3 of them, to be honest. And we already see that the bundled payment care is moving the model to where you have mandatory participation in bundles that you didn't have to do last year. And we already see that we have evolution of the innovative models through moving forward with the DCE, or the direct contracting entity model. And we see commercials sort of, as always, they sort of follow suit in some of these programs that come through the federal work and try to implement similar type models themselves with the commercial populations. And then we already see market consolidation. We've seen some biggies happen this year, those that I will keep nameless, but I think we've seen a lot of that happening, and we'll continue to see that happen. So yeah, I think that I think we're going to see a lot of shift over 2021 and into 2022 as well.
Anna, do you agree?
I would say I would check all of these boxes because they're already happening. And then I would say if we're really thinking about the future, I would check the other box. And my other, if there was like, oh, comment on this, would be really that on a foundational level, we are coming together as a healthcare ecosystem, payers, vendors, providers, gyms, the YMCA, whoever, you know, is in that healthcare ecosystem. There's so many players. We're coming together to figure out, how do we share our data? How do we connect this story with patients? How can the federal government help us do that through standards? How can we hold the accountability and the execution of those things to make it all happen? And so I think all of these things are already checked, and that we're really looking towards a future where we're building infrastructure to enable us to really personalize that medicine, that coaching, that care, that healthcare that we always envisioned healthcare being, you know, a partnership of the ecosystem, even with the patient. So that's my view of the shift in 2021 and beyond.
Let's take a look at what the audience thought when they were forced to pick one.
Yeah, we weren't forced.
and pull up the poll results and take a look. Still waiting. Well, it looks like they were evenly split, and benchmarking seems to be an opportunity for the future.
Yeah, well, absolutely.
That said, let's and that makes sense given our discussion. So let's take a look at what the future may look like. You know, we've talked a lot about kind of where we're at, what we're learning, where we may go. You know, what do you think this future looks like? Anna, let's start with you.
Yeah, I think it's more personalized. It's the right care at the right time in the right place. That might mean a hospital at home. You might not need to be in an inpatient unit getting the care you need. That may be more appropriate at home with some. Now that we have these devices and innovations that can come along with us in the field, that's enabling us to put care where it should be, or meeting the patient where they are. So I think the future is using the data, the interoperability, the aggregation of all this information to really customize healthcare for that patient, meet them where they are. If they have asthma and they're going to the ED 5 times and they need an air conditioner, we're moving the dollar around so we can get them that air conditioner to live that better life, not necessarily see them in the ED all time. So it's shifting the mindset around what health is. It's that new word, the CDC even defines it, well-being. I don't know exactly how, but it's meeting the patient where they are and shifting the care where it is, and using that data and information to figure out who needs it the most, that equity and equality, all of that, putting it into that equation of getting the care to those that need it the most where they are.
And it's interesting, I've got a bunch of questions flowing in from the audience asking, what was the underlying technology you're using to achieve interoperability? Are you using third parties? It all speaks to this last bullets. Do you want to take a stab at that?
Oh my gosh, there's so many. So just as complex as healthcare is, or diagnosing a patient is, so is interoperability. So we use several platforms, but what I really want to speak to is the standards. So we've been really focused in on moving towards FHIR, using the use cases in Da Vinci, and picking partners, innovation partners like Innovaccer, who can aggregate data for us, who can do some of the plumbing for us. So we use several different types of platforms to make that happen. We're moving toward a more FHIR-enabled organization so that this data can be standardized as we move it between entities and organizations. And we have many technology vendors that we utilize to make that happen. Many partners, I would say, not just vendors. Innovaccer is one of them, and they help aggregate our health information and really center that data around the patient. So what's been hard is you have all this data, and now we need to get it in one place and look at it in one way, from one lens, from that patient lens. So this is one platform that enables us to do that.
And Tamra, do you want to speak a little bit about your perspective as the population health engine driving this?
Yeah, I think that you know, Anna is working in a large system with large payers, and we have that perspective, but we also have the independent perspective. And so one of the benefits of the Innovaccer platform for aggregating data for us was that they're really good at taking any kind of data and mapping that data so that it becomes that integrated record, no matter what form or format that we are able to capture it in. Again, a single doc shop is not going to have they don't even have, you know, the technology person in-house to help them do this. So part of what we get through the benefit of using the Innovaccer platform is their technology folks help us capture that data in a format that we can use it in the Innovaccer platform. So while we strive to do the FIRE methodology for, you know, our bigger entities that we work with and partner with, we also have to really make sure that we can assist and meet some of those smaller clinics where they're at in that technology trip.
That makes a lot of sense. Well, we have time for one or two more questions here. Here's a question. Was your population health management program inclusive of all network physicians assigned membership, or exclusive to a handful of physicians that you focused on in terms of the success of your population health program? Anna, do you want to take a stab at that?
Yeah, so I would say that a lot of the activity, going back to that primary care provider, that we focus heavily on how our primary care providers interact with the patient, because they're like the head coach of the football team. There's a lot of specialists on that team. There's the defensive end, there's the, you know, the quarterback, there's all of that, but they're the head coach, and we focus a lot on enabling those head coaches to be successful in closing care gaps, ensuring that we're coding properly to the patients with our HCC codes. Those are that's who we focus in on the most. And then as we mature and get more and more advanced as a population health in our practices, we start focusing in out on care pathways. Like, what is the care pathways for somebody with diabetes? What is the care pathways with somebody with COPD? What are those walkways, and who's involved in those walkways, and how do we make that happen? But initially, we focus in on primary care providers.
Yeah, well, I can say, you know, being involved in an early part of this journey myself, and then working with my colleague, Dr. Paul Grundy, who is now here at Innovaccer as well, the godfather of the patient-centered medical home. The two of us worked very closely with the Obama administration years ago in trying to get primary care as a foundation for this accountable care. I just really am thrilled to hear that perspective from you. This really concludes the time we have for the webinar, and building the future of connected teams, a story of innovation. It's just really exciting to have both of you here. Thank you both so much for sharing your experiences and your collaboration with us.
Thank you, Dr. Nace, for having us.
Thanks for having us.
And thanks to all the audience. We will follow up and provide you a copy of this slide deck so that you can learn from the experience you heard about today. And we'll also send you a little packet of information around Innovaccer, which has been winning many awards for supporting the kinds of teams that you heard here today. So with that, this concludes the webinar. Thank you very much for attending.
Thank you.
Thank you.